I give them as much information as I can give them at that first meeting. Really big, I try to give them the big picture stuff because they need to know, people need to know what they're facing. And if we're missing some key information, I say that we need this, this, and this. We're gonna get all these tests done this week. I'm meeting back with you Monday. We're gonna go over all these results and we're gonna have a plan by the end of the day Monday. Sometimes there's just one kind of clear-cut way to go, but many times there's a couple of ways that you could go that are reasonable, but they have pros and cons attached to them. I think it's really important to know the patient as much as we can, because the pros and cons will weigh differently with individual patients depending upon what's important to them, their beliefs and their values. So I really try to talk it through with them. If we go down, option A, this part will be a little harder, but we might get a benefit for this aspect of it. If we go down pathway B, this part will be a little easier, but this might be the downside to this one. And we really try to talk it through. I tell the patients all the time, you're the boss, I work for you. Let's try to make this decision together. And we're not gonna do anything you don't want to do. I'm just gonna try to educate you and give you options, give you my recommendation, but you have the final say. And then you put the plan in place. And then now you're talking about a treatment, So now they want to know the details of the treatment. What are the drugs? What are the side effects? How am I going to feel? How long is this going to last? You go through all that. And then they're just really anxious to get started. So we're getting going within a day or two of that. So we really try to move it along fast. It's a whirlwind. Then you take them through this treatment. The treatments, they have side effects, but usually the patient starts feeling better because the disease was bringing them down, and now you're making the disease go away and those symptoms are being relieved, maybe being replaced with some treatment effects. So we got to talk them through that, manage that. Anyway, fast forward, you get to the end of the treatment, and then you get to walk in the room and say, your scans look great, you're in remission. And they are so happy. And then they usually say, can I ring the bell? Because we have a bell in clinic that you can ring when you finish your treatment. I say, you can ring the bell today. I came to Washington University because it's really one of the premier medical schools and medical complexes in the country. I'm not even sure people in this area realize what a gem they're sitting next to. Specifically, I work in the Cancer Center, Siteman Cancer Center, and it's really one of the most prestigious, most highly ranked cancer centers in the country. The Siteman reputation is really a reflection of the people that occupy Siteman Cancer Center. The greatness of an organization really depends on the people that work there. It's not really the bricks and the mortar or how pretty it is, although our buildings are very pretty, but it's the people that make any organization great. And great people tend to attract more great people, and then you get this culture of excellence. The role of clinical trials in cancer cannot be overstated. Everything we know today we've learned because of patients who participated in clinical trials 2 years ago, 5 years ago, 10 years ago. So we always offer clinical trials to patients whenever we think it's appropriate for that patient. And it's one of the things I love, about being at Siteman is the fact that we have this incredible research infrastructure that allows us to run, gosh, I don't even know what the number is. We have hundreds of clinical trials open at any one time that we can offer these to our patients so we can provide great cutting-edge care to that patient at the same time we're advancing the field for the next breakthrough. And this treatment that is new and experimental today could be the new standard 2 or 3 years from now.